Hello, everyone. Thank you for your time. Before moving to the software, I'm going to just introduce briefly for DoctorSim. DoctorSim, excuse me.
صباح الخير. بس أنا حابب أعرف عن حالي. أنا بلال نجا، رئيس قسم التدريب والتعليم المستمر، ولاحقا سيتحول إلى المركز الإقليمي للتدريب في المجلس التمريض الأردني. المجلس التمريض الأردني أحد الدوائر الحكومية في الأردن المرتبط ارتباط مباشر برئاسة الوزراء، وبتشرف فيكم وبتشرف بالدكتور موسى، يمكن مرة التقيته بالمجلس. شكرا لكم على هذا الميتنج.
شكرا لحضرتك، شرف لنا. شكرا.
Thank you. Okay, for DoctorSim editor, just a brief introduction. It's from a manufacturer called Accurate Solutions. It's an Italian brand dedicated for virtual screen-based patient simulator. It's intended for undergraduate medical students, and when we add complications, it will be intended for postgraduate medical students. It's on high demand anywhere from medical schools and to practice on how to do the physical examination, the ABCD protocol, to solve problem-based learnings, clinical skills assessment, how to take patient history, teaches us what to ask for diagnostics like the X-ray images and blood tests, how to plan for a treatment, and how to approach the patient. To start with the advantage of having this software, I will start with the advantage for this software. This software can be sent when you purchase this software. It can be sent via a link by an email. So no need for shipping for this item. It's just a link and you install it on your any laptop and desktop. I will send you the requirement, the PC requirement on the chat. Okay. Okay, I have sent the minimum system requirement for the PC on the chat column. It's a one-time purchase, so lifetime license per device. This means that when you buy DoctorSim editor and you install it on a certain laptop, you can use it lifetime. Therefore, you have no yearly cost for updates, unlimited number of users within the same institution, unlimited data entry. This means that you can create unlimited number of clinical cases, unlimited number of scenarios, and you have pre-programmed scenarios. You can edit the pre-programmed scenarios as well if you wanted to. Okay, any questions about DoctorSim editor before we move to the software?
Is it only a software, not a hardware?
Software, it's a software, yeah. It's a screen-based virtual patient
virtual
software.
patients. Virtual
exactly.
patients.
You have two interfaces. You have the student interface, which is called DoctorSim Player, and you have the instructor interface, which is called DoctorSim Editor, where the instructor edits the parameters. Okay, when you purchase this software, we send a link and you install it as an instructor on your private desktop. Okay, and you can of course import it to the learning management system, the Moodle. And another software should be installed on each and every student's their private laptop, which is called DoctorSim Player. And the pre-programmed scenarios, you can install them as well on your DoctorSim editor from a site called DoctorSim Academy. Okay, so you have you have DoctorSim Player, DoctorSim Editor, and DoctorSim Academy.
Natalie, who can build the scenario?
Yeah, you have pre-programmed. You have list. Yeah, you have pre-programmed scenarios that are scenarios already done by Accurate. You can import them. This is the first thing. You can edit those pre-programmed scenarios if you want to, and you can as well create your own scenario from scratch.
I see.
Okay, so the doctor, the instructor, can create own scenario, okay, according to the students' need. For example, you can create COVID scenarios, heart failure scenarios, COPD scenarios. You can create as much as you have. It's unlimited, so you can create as much as you want.
Excuse me, ma'am. This is Mahesh from Bahrain. So you want to create your own scenarios means you need to be having DoctorSim editor.
Yes. Yes, correct.
Thank you.
So from the interface DoctorSim editor, since the name refers to it added, so the instructor should edit that scenario. You can edit the pre-programmed scenario, and you can as well create your own scenario from scratch. Okay. Any questions?
Not yet.
Okay. So we are good to move to the software. Okay, I shared my screen. Okay, as you can see here, I think it's small, but you can still see the icons. So this is the DoctorSim editor, and this is the DoctorSim player. Of course, the DoctorSim player should be downloaded, should be installed on students' laptop. But here, in order to be able to share both interface, I had to put them on my desktop. Okay, so you just click on DoctorSim editor, and you will have this interface. As you can see here, I will start from the top. You can select, this is the DoctorSim editor, it's the instructor interface. Okay, we have to create a scenario here. So the first thing from the top, you can select the language that you want. So it's English. And this one, you can import the scenarios that you have already pre-programmed. You can import it from a site called DoctorSim Academy. Okay, when you buy the software, you will have the credentials for that website, and you can download the scenarios from there. Therefore, here are the pre-programmed scenarios. You have many. I have just downloaded those scenarios. I will select for today acute pulmonary edema scenario. So you click on acute pulmonary edema scenario, and then you click on open scenario in order to be able to open the scenario. Okay. Here again, to start from the top, this is the button to go back. Here you select the language that you want. Here it's the general settings for the score, for the Moodle. Here, when you want to show a preview of the case, so whenever you created your case and you saved, you just click on this in order to play the scenario for you as an instructor to see how it will look for the students. And this one, I will go, once I finish, I will let you know what's this button. Okay, it's for the Moodle. So once you finish the scenario, you save it on your desktop as a SCORM package, and then you send it via a link, a zip file to the students to download, so that the student will download it to their interface and start working with the scenario. Okay, we'll do that afterwards. This is the interface I want to fill. I have already filled the details, but just to go briefly about them. Here, the picture of the patient, you are able to put it. The name, surname. So my patient is Keith Aloni, age 79, female, her height, her weight, and nationality. You can create different days. Okay, so you can start with day 1, having the time that the patient admitted to the hospital, and you can create scenarios with different days in order with evolution for each day. Okay, you can just have an evolution for each day. Therefore, you click on the edit button, and for day 1 and step 1, so here in my scenario, I have that day 1, step 1, and I have day 2, step 2, which is 2 hours later. So day 1, at the patient admitted to the hospital at 3 a.m. Description, it's an introduction, label ER. I save everything. And then I go here. The patient type is not yet implemented, but they are working to update the software to have different patient types. So here in my scenario, it's adult, and then you will have an ability to select ages. So you can have a scenario for pediatric, newborns, geriatric. So you can select the type that you want according to the age of the patient. Here it's the introduction. In the introduction, as an instructor, I should write an introduction to what is my case, okay? So that this sentence, the students will read it and have an idea about what is the case about. The patient reports that she woke up suddenly in the middle of the night for sudden shortness of breath associated with profuse sweating and feeling of imminent death. She is very scared. Her husband called the ambulance immediately. Okay, so this is the introduction. Her husband called the ambulance immediately. She was admitted to the hospital due to shortness of breath, and she was sweating and feeling of imminent death. So this is as an introduction. Diagnosis. So here I'm expecting from my students, after doing all the maneuvers and examinations and therapies, to write a report about the patient's diagnosis. So what kind of diagnosis they have according to this patient. Okay, so for example, I expect from my students to diagnose that this patient has an acute pulmonary edema, a hypertensive basis, so all these things. Last thing, case description. So it's acute pulmonary edema. I want to hear from my students that this case is acute pulmonary edema. And anamnesis, this is patient medical history. So my patient history of my patient is that she's hypertensive, she has diabetes, osteoporosis, and hip implant. Now I want to start filling each and every step. I click on the patient object. Here we have lists of objects. We want to click on it so that the list of objects that we want to select will appear in the graphics of in the rooms, okay, in the patient room. Physical examination, the second thing. Okay, for the physical examination, as you can see here, you have areas that you want to examine. So you select the areas you want to examine from head to abdomen. So you have the head, you have the mouth, you have the heart, you have the lungs, and the bowel. Okay, for the head, I have nothing to examine the head. For the mouth, it's normal. For the heart, here you have a library of heart sounds. Okay, so you click on the added button and you say that when the student will auscultate the patient, I want him to hear a systolic murmur. And you as well click on the library of the sounds. These are sounds recorded MP3, and you select the sounds that you want, heart sounds. Then you have the lung. Again, the same thing. You click on the edit button. You say that I want wheezing, and you select from the library of the wheezing, of the library of lung sounds, and you select the lung sound that you want. And the same thing for the bowel. Here I have selected normal. This is for the area that you want to examine the patient. Now coming for the vitals, for the patient animation. If your patient is conscious, it depends. If you have a traumatic scenario, a scenario for trauma, and your patient is unconscious, therefore you can select your patients to have a closed eyes, immovable limbs, arm and legs. Okay, but here my patient, she's conscious. I have selected to have open eyes, respiration accelerated, and the limbs immovable. Coming to the vitals, here you can select the vitals, that the parameters that you want to. So you click on the edit button and you select the heart rate value, the FR, the oxygen saturation, it's low, 88, temperature, blood pressure, and you can click on this library and you select the cardiac rhythms that you want to. I have selected the sinus. Everything you change, you write, you click on the right sign in order to save the things that you have created. I want to save it. Now the questions and answers. So here, as an instructor, I want to create list of questions for the students to ask to the patient, and list of answers the patient should answer the students' questions. For example, I want to read the first one. As a student, I will ask my patient, have you checked your blood pressure recently? The answer of my patient should be, yes, I measured it at 3 to 4 days, never above 13/13.5, and always below 85, the minimum. My doctor has always told me that it is fine. And you have a good thing here, that you can record your voices in an MP3 file, and you can import it here, so that when you ask a question to your patient, you will hear rather than writing the answer of the patient. So I will not go over all of them to make it short. So here are the list of questions and answers. You fill them. The examination. So here you have list of requested exams to be done for the patient. You have a good thing here, that you have the choice to select to write correct, irrelevant, or wrong questions. For example, you add many as you want list of exams. For example, the one that is ultrasound for arterial vessel. Actually, you don't. It is not. It is a wrong. So I put them and I put wrong, so that the student, if selected this kind of exam, this means that this is no need to do this kind of exam. Okay. So here I can select the exam type: correct, irrelevant, and wrong. And if I want, for example, pulmonary ultrasound, this is a correct type of examination should be done by the students. So I write the pulmonary ultrasound. I select the type, it's correct. This is what I want for the students to do, and the score. Okay, if it's correct, I put 1. If it's incorrect or it's wrong or irrelevant, I put -1. And report like diffuse. As you can see, you have many B-lines. Okay, to make it short, I will not go over each and every one. For the this is for the therapy. So what kind of therapy I should give to my patient? You have list of therapies, but not all of them are correct. For the student to choose the correct one, and you have list of maneuvers to be done. And again, you have, for example, here you can see oxygen mask 2 liters per minute, oxygen mask 15 liters per minute. So you have the choice to put the name of the therapy, the name of the maneuver, how much cc you want to give to the students, and you can just change the values so that the student will choose the correct value. For example, if they choose the 2 liters, it's wrong because 2 liters is not enough. It's not enough oxygen to give to my patient. So the student should choose 15 liters per minute. This is the enough concentration, the amount to give for the patient. Okay. So this is about the DoctorSim editor, how we fill and how to create a scenario for each and every part. Once I create the scenario and everything is saved, I click on this button. This is in order to generate, to save my file in a SCORM package and to send it to my students so that they use, by using the Moodle, they will start working on the scenario. So I click on this. Okay, I want to save. I want to save it on my desktop. It's pulmonary edema as a zip file and SCORM package, the type, and I save it. Already exists because I already have it. I will replace it. I wait about a minute in order to be exported. Okay, it takes time, so I don't want to lose time. I have already exported it here. So this is the pulmonary edema. So it's saved. So this file, this zip file, which is SCORM, so it says exported correctly. Okay. This is the file that I have saved it, and I want to email it to my students in order to drop it in their interface, on their interface, and start to play with the scenario. So now I'm the student. I will open DoctorSim Player. Okay, so this is the interface for the student. And it's very simple. I just download it from the email that my instructor sent it, and I drop it here. So once I drop it here, it will be written pulmonary edema. I click on the play button. Okay, so here I should wait a minute to do the loading, to start viewing the scenario. Okay, it's ready. Okay. I will maximize my page. Okay, so this is the interface, the student interface that when they do the process, they will this will be opened. So as an introduction, okay, me as a student, I want to know the case. I open for the introduction and I read the following. The patient reports that she woke up suddenly in the middle of the night for a sudden shortness of breath associated with profuse sweating and feeling of imminent death. She's very scared. Her husband called the ambulance immediately. Okay, so I have an idea why she was admitted to the hospital due to shortness of breath. She was sweating and she feels scared. Now I want to proceed to simulation. Okay, proceed to simulation. Okay. As you can see here, my patient, she has an accelerated, her limbs are not moving, her eyes are open. Let me just okay, so this is the patient's room. Okay, you can move around. Okay, so as you can see, I have day 1, step 1, and I have day 2, step 2. So day 1, this is the time admitted, the patient admitted to the hospital, 3 a.m. And I have, as a student, I have 12 steps to complete, to do them in order to complete this scenario, to complete it successfully. Okay, so I have, as a student, I have a hint that I have 12 things to do in order to complete my scenario. Before I start with this, with the examination, okay, just a look for the patient that the respiratory, she has an accelerated respiratory, eyes open, and she's not moving the limbs. Okay. So to start with the medical, as a student, I want to get familiar to my patient. So I need to know details of my patient. My patient name is Keith Aloni, 79 years old, 72 kilogram, and 158 centimeters. What is the medical history? She's hypertensive. She has hypertension, diabetes, osteoporosis, and hip implant. Okay, so this is the medical history for the patient. Sure, I want to start with the questions and answers. So I want to ask questions for my patient. First question, have you checked your blood pressure recently? And the patient should answer, yes, I measured it every 3 to 4 days, never above 13.13.4, 5 the mass, and always below 85 the minimum. My doctor has always told me that it is fine. So this is one of the questions. What happened? I woke up suddenly because I'm out of breath. I can't get any air. Are you able to see my screen?
Yes.
Yes. Okay.
Yes, sir. Yes, it's very
okay. So here you have list of questions. You asked your, if you have recorded, for example, I want to ask if you have recorded a voice, MP3 voice. When you ask, have you had any special illness in the past? The patient should say that you will hear the patient saying, I've been treating myself for hypertension and diabetes for a long time. I always have pain everywhere, and I have a hip implant. So if you record a voice, this will not appear. Okay, the writing, and when you don't record, writings for the answers will appear. Okay, so this is the part of the ask questions. I want to check I go to the examination. Here are list of exams that my instructor put them, but I have to select which ones are the correct ones. Okay, I will start with the physical examination. So I go to the patient and I start to do the physical examination. As you can see here, you have the bowel, you have the heart, you have the lungs, okay. By doing the physical examination, you can hear it's normal. Okay, for the heart, when I click on the heart, I'm not sure if you are able to hear. We have systolic murmur. Okay, for the physical examination, I want to open the monitor. I want to put my patient on, I want to see the cardiac rhythm on ECG, the blood pressure, the FR, the OSAT, and temperature. I want to do the physical examination. So for example, for the heart, okay, as you can see here are the ECGs. Okay, I put them to appear on my vital signs, the OSAT, the blood pressure cuff. So this is the part of the monitoring. I will start with the examination. As I said, we have list of examinations to be done. For example, it has nothing to do with abdominal ultrasound. So my case, if I open the abdominal ultrasound, it will show me as an irrelevant. Pulmonary ultrasound, I want to do pulmonary ultrasound. I will receive, okay, so here it's the B lines that we have already put them. Pulmonary radiography, I asked for an X-ray. So this is the X-ray. This is a picture already. And you go to here to see the X-ray images. There's a little bit of delay, okay? So okay, so this is the X-ray image that I have requested. Okay, cardiac ultrasound. So here, I requested cardiac ultrasound and they sent, so I have to diagnose that. What is it? lab tests. So when I request lab tests, I receive the following. So ultrasound of arterial vessels. So it's writing unnecessary examination because the student now selected a type of examination that there is no need to be selected. It's not correct to select this kind of examination for this scenario. Arterial blood gas. So these are the lab tests. If you can see here, remaining actions, when we started, it was 12. Okay, so we have 12 steps for the student to do in order to complete the scenario. So I'm doing list of things, and remaining action, I still have 6 steps to be done in order to complete my scenario in day 1, step 1. So these were the examinations. Now the therapy. So these are the list of therapy that should be given to, these are the list of therapy that my instructor put them, but I need to select correct ones, okay? So we have nitroglycerin, we have many things. So the correct ones are, I should give my patient diuretics. You can see it's correct, and the remaining step is 5. Intravenous adrenaline. This is not correct answer, so I should not give my patient as a therapy intravenous adrenaline. So the student selected wrong. I will try nitroglycerin intravenous administration. So this is a correct action. And the blood pressure was reduced, if you can see here. Okay, 100/70. So it helps. For the maneuvers, we have list of maneuvers to be done. As I said before, as an instructor, I have put many different concentrations or amount of maneuvers, oxygen to be given to the patient. You have oxygen mask 2 liters per minute, and you have oxygen mask 15 liters per minute. So if I choose 2 liters, it's a wrong answer because it's not enough. So the student should choose 15 liters per minute. And here you can see we give the oxygen mask applied. And we still have 3 steps to complete the scenario. Now for the maneuvers, another thing, positioning of the bladder catheter. So I put, and I get 40 cc of urine. I want to give venous access, and you can see here we're giving the venous access, and still you have step 1 for day 1 in phase 1. And I want to put my patient on CPAP, application of the helmet for the CPAP, as you can see. Now you can see that for day 1, I have completed everything related to day 1, phase 1. Now we have moved to day 1, phase 2, which is after 2 hours. So I had the patient, I examined the patient, I gave him certain therapy, and after 2 hours, I need to check if the therapy given to my patient was efficient. So as you can see, I have completed 50% of the scenario. Now I want to ask questions for my patient. Are you breathing better after 2 hours? Yes, but I hate this helmet. Another question, how are you? Better, thank you, but take this thing off. So it looks that the patient is better. I want, in order to check if my patient is better, I want to do the physical examination needed. So before 2 hours, the amount of urination was 40 cc. Now it's 500 cc. When the patient admitted to the hospital, she looks sweat. She was sweating a lot. Now she's less sweaty. She has pink extremities now, but still she has wheezing and systolic murmur. Another type of examination, so still I have one step to complete for phase 2. I want to check the arterial blood gas. So this is a report of the arterial blood gas that my patient has been better than before. So remaining action in step, it's 0. So the student completed all the actions that should be done. And you can see here, it's 100% complete. And you see that the light is turning on and off. You click on this button and you say end clinical case. When you end your clinical case, a report will be generated according to the things done during this scenario. So I click on the report and I know each and every student what they did. Everything highlighted in yellow, it's irrelevant things done by my student, and everything highlighted in red, it's wrong actions. So as I said, it was not necessary to do abdominal ultrasound. It's irrelevant. It means that when the student chooses to do abdominal ultrasound, it's not wrong, but it's time consuming. But when the student decides to do ultrasound of arterial vessels, this is wrong, so it should not be done. And another thing for the therapies, I should not give intravenous adrenaline. So it's contraindicated medicine. It's a wrong medicine I have gave to my patient, okay? And everything is not highlighted as in yellow or red. It means that it was correct actions students did it. This is everything about the software. Any questions? You can restart.
Yeah. Is it suitable for the School of Medicines, not the nursery that I would imagine on the emergency training or the...
It's suitable for both. So according to your scenario, if you make your scenario simple as a nursing scenario, therefore it will be intended for undergraduates and nursing. But if you add complications, it will be intended for according to the specialty again. So
I see. It can be intended for both based on the scenario.
Exactly. So you can make it basic as much as you
exactly.
want.
Also, it's dependent on the level of students. If they're year 1, year 2, year 3, either medicine or nursing, usually clinical communication skills and clinical, let's say, management skills are the same for both, actually.
As soon as you can govern it by the scenario setup, that would be suitable for any medical or paramedic students.
Exactly.
That would be fine.
Any questions?
Natalie, will you go or explain a bit about the integration with the Moodle?
Yes, sure. So the Moodle, it's a learning management system for the universities in order to for the student to see their to do their exams, their evaluation, everything related to that software. So this DoctorSim editor can be so the student can do this and evaluate it on the Moodle. Okay, this is as you can see. So this is the to be used on your learning management system software.
Natalie, is it the license? Is it a master license or by seats?
Can you, Dr. Musa, can you repeat your question? I didn't.
You said there is a license when someone buys the software plus the editor. Are they limited with the number of seats?
No. If we are using it within the same institution, it's unlimited to the number of students or users.
It's a master license for each and every institution.
Yeah,
yes,
yeah.
And,
so when you buy this
one license per institution, and it's for lifetime.
Exactly. Per device as well.
And this is one license for both of them, for the editor as well as the player. It comes both together.
Yes, it's for both. So when you get when you buy the DoctorSim editor, a link will be sent to your email, and you will have the credentials for DoctorSim Academy, and you send the link, the other link for the DoctorSim player from that site to your students in order for each and every student to install it on their private PC.
On their private PC, okay.
So once you get the DoctorSim editor, you will get all the other things. You will get the DoctorSim player, you will get the DoctorSim Academy where you download the DoctorSim actually player, and you have many pre-programmed scenarios, and each and every time the scenarios are being added. So every time Accurate makes a pre-programmed scenario, it will be added on that site.
Natalie, I have a question.
Yes.
الآن لو أنا اشتريت الدكتور سم إديتر للتريننج سنتر للجي ان سي، حطيناه بالمركز التدريبي، حطيناه مثلا على عندنا حوالي 96 جهاز بي سي. الآن لو بدي أدرب عليه ممرضين أو طلاب كليات تمريض، بيطلع لي أدرب على البلاير وخلاص هو شامل لرخصة الإديتر، صح؟
100% صح.
أوكي.
صح، يعني انت هون بهالحاله عندك unlimited number of users، يعني عندك 96 او hundreds بتدرب عليهم طالما انت in the same institution. يعني عم نحكي بالكونسل you are unlimited to the number of users. بس اذا بدنا ندرب بغير جامعات لا، كل جامعه بده يكون عندها الاديتور تبعها. ويو as an editor you يعني هيدا اللينك اللي بيوصل لك تعمله انستول على your own لابتوب، بتضل عليه forever.
اوكي.
اوكي.
الرخصه for 1 year and renewing yearly؟
لا، رخصه لايف تايم.
It's a one-time purchase, so you only buy it once and that's it. You don't pay anything later. So it's a lifetime license, and all the updates that will come, you will receive it free of charge forever, for life.
Exactly.
اوكي. طيب سؤالي الثاني نتالي، لاني انا انترستد في الموضوع كرئيس قسم تدريب عشان اعرف اكتب التقرير الفني للاداره عندي كامل مع توصيتي بالشراء او عدمه. الان بخصوص السيناريو الان بدي اركب مثلا، الان عندي نتالي مشكله بمرضى الكوفيد، اني انا بدي ادرب النيو نيرسز. صار عندنا انت بتعرفي مستشفيات ميدانيه عسكريه حوالي 6 مستشفيات بالاردن. الان طلبت مني وزاره الدفاع وعفوا الجيش ووزاره الصحه تدريب النيو نيرسز على موضوع الكوفيد، فضلينا نلف هاندز اون تريننج. فيري ديفيكلت اني اجيب ناس مش مريضه بكوفيد وادخلها على مرضى كوفيد عشان ادربها. الان مثلا انا كيف بدي ابني سيناريوهات فور كوفيد بيشنت عشان ادرب عليها هدول النيو نيرسز اللي بدنا نعينهم او تعينوا في المستشفيات الميدانيه العسكريه لمواجهه هاي البانديميك. فالموضوع عندي بالسيناريوهات، هل البرنامج بأمن لي السيناريوهات ولا انا كل ما بدي كيس معينه بدي ابني عليها انا سيناريو الي بالمجلس؟
اوكي، هلا هيدا السوفت وير هو معمول بسبب لانه نحن هلا during كوفيد كثير صعب نعمل يونيفايد تريننج هاندز اون بالمستشفى due to هذا البانديميك اللي نحن عم نقطع فيه. كرمال هيك صار في virtual patient screen based virtual patient simulator. نحن كوفيد سيناريوز في عنا كذا سيناريو، بس اليوم دائما بننصح انه for the instructor to create his own scenario. يعني كيس صار معهم بالمستشفى وبدهم الكل يكون فاميليار لهيدا الكيس مثلا. سو دائما بنقول بكل السيميليترز not even مش بس بليميتد لدكتور سيم، ننصح دائما for the instructor to build his own scenario. يعني بنبلش from scratch مثل ما حكينا. رح يجي هو اذا بدي ارجع for the back بس اعطيك فكره، هولي كل السيناريوز اللي هن بري بروجرامد، بعد في اكثر بس انا بس نزلت هولي in my interface. is if you want to create a scenario from scratch تبلش من الاول، انت بتكبس على هيدا البutton which is the plus sign. You click on it and you write the scenario that you want. For example بدي اعملها COVID. اوكي، بكتب كوفيد JNC1 مثلا. اوكي، and if you want to have certain COVID things you just edit the one that you have already created. يعني بكبس عليها بكتبها. اوكي، so COVID JNC بكبس عليها دوت لي ازرق open scenario، بكبس السيناريو. اذا بتلاحظ كله فاضي، انا as an instructor I have for example بلش من الأول، بحط صورة المريض، بحط اسمه، طول، كل الانفورميشن بدي إياه، أي ساعة فات على المستشفى، على أي day COVID patient بفوت على several days in order تنراقب الإيفولوشن اللي عم بيصير معه. بحط كل الديتيلز هون. introduction مثلا شو حاس، كان حرارته مثلا 9 وقت فات على المستشفى، كل هالتفاصيل، شو بدي بالأوضة يكون، شو بدي الفيتال ساينز، شو الكويشنز اند انسرز بدي بسأله انه قد ايه لك بالحرارة، عم بيسعوا، كل هالتفاصيل، وشو الثيرابي اللي انا بدي اعطيه بالاي سي يو. اوكي، لحتى في يوصلوا للمريض يوصل على induced coma for example. انا بحط مثل ما بدي from scratch. يعني انا في استعمل سيناريوهات اللي محطوطين وبعدل عليهم لحتى فيه، يعني سيناريو موجود في بروجرام تعدل عليها فيه، وفي اخترع
طبعا
سيناريو
مهم
انا
جدا. سوري ناتالي، بس مهم جدا تعديل بسيط بالسيناريوز عشان موضوع الغش. يعني عشان الطلاب ما هو حيدخلوا افواج، عشان ما يكون في كيس واحده، على القليل يكون في 10 12 كيس. هو البيكتشر العموميه نفسها، بس يكون في تعديل بالتفاصيل بسيطه عشان الطلاب ما يعني يصيروا يحكوا لبعضهم ويغشوا من بعضهم. عرفت كيف؟ فهذا التنويع مهم ولو بالتفاصيل الصغيره.
100%
طيب
بتغير الفيتال ساينز.
مستر كارلوس، بس انا في سؤال. معي مستر كارلوس اللي كان معي مره بالجامعه الالمانيه في مادبه بدوره بالاردن.
صحيح
هو نفسه كيفك؟ شو اخبارك دكتور؟
والله الحمد
انا
لله.
بلال
الحمد لله،
نجا
انبسطنا شفناك
معك في الجامعه. كيف صحتك؟
غني عن التعريف.
لا خلص هيك
عرفتك
ولو هيك نتالي الامور واصله ما دام عند الدكتور كارلوس اموري طيبه.
سيد بلال انا بحكيك، انا حسام ملحم، انا ريبريزنتنج سيميوليد في الاردن اذا سمعتني بالبدايه كمان. وانا راح اعمل لك يعني بيست لرقمي على الشات بوكس، ويا ريت انت اذا بتبعت لي رقمك عشان نتواصل ويصير في تواصل بيننا، يعني حتى اخدمك كمان في موضوع الدكتور سم بزياده، يعني لو حبيت تفاصيل اكثر كمان انا جاهز يعني بعد ما تخلص. فانا راح ابعت رقمي هلا على الشات بوكس، وزي ما حكيت لك انا بيست في عمان، يعني متشرف فيك.
اوكي.
ناتالي Hello.
Sorry, I was on mute. Yes. Hello, Mahesh.
This, if Accurate comes out with a new scenario, they will put it in Academy.
Yes. So now we have like 15 pre-programmed scenarios. Every time a professor has an interesting scenario, they will add it on their on the DoctorSim Academy site. Okay. So every time we have more scenarios, it will be added, and all the users will benefit from that scenario, the new scenario that is added. Okay, it's free.
Okay. Okay, thank you.
The academy,
Welcome.
Is like a pool where everyone in this academy will be sharing his case. Like, for example, Dr. Bilal, later on, if you will be doing your own scenario, you will post it on the academy, and everyone else will be doing this. So there will be a lot of cases to share between others. So this is the interesting part of the academy.
Nice.
Okay. And if you can just see my screen, I have opened, this is the website, doctorsimacademy.eu. So you will receive the credentials, and you will open, the website will be opened. Everything for the cases, case library, it's here. So you click on DoctorSim Clinical Case Library. Okay.
Okay.
And you see we have many cases. You have things with language Italiano. So we have not, we are interested in language English, for example. You have a ascites and hyperammonia, for example. You have this case. You have another case for acute pulmonary edema, which is the one I have did now. You have, okay, you have many scenarios, and every time the scenarios will be added. This is the part of the scenarios. If you want to send the link for the students to download the DoctorSim player on their private PCs, you just click on the tools.
Okay.
Okay, and here you see you have, you have DoctorSim player. As you can see here, this one, DoctorSim player setup exe. So this is the one that you install DoctorSim player on your PC, and you send it to your students to download it on their PC as well. Okay. This is the DoctorSim Academy that we are talking about.
Thank you.
Welcome.
Many thanks for everybody for this nice orientation, full information. أنا بشكركم جميعا، وبتمنى إذا حدا من لبنان نزل على الأردن إن نشوفه بخصوص هذا الموضوع. أنا انترستد فيه وراح أكتب فيه كتاب منيحة يعني عندنا فنيا، وبتمنى إنه راح أتواصل مع الجميع. راح أتواصل مع الدكتور كارلوس، لأني تشرفت إني مرة أخذت عنده دورة سيميوليشن في الجامعة الأمريكية بمادة، هو كان داعم لشغل المجلس صراحة كثير. وشكرا كثير.
شرف لنا. لا، وزميلنا حسام، يعني زميلنا حسام في عمان هلا قعدنا الانتشار شوي، صار عندنا زميل في كل بلد عشان شوي يعني محدودية السفر. أنا طبعا لسه بقول يعني عايز أروح عمان بأول فرصة يعني. حاليا زميل حسام أكيد راح يكون قدها وقدود، وإن شاء الله طبعا مع كل اجتماع نحن بنكون معكم عبر الفيديو بس، ولكن على الأرض الزميل حسام يلي هو خبرة 12 سنة ما شاء الله، زميلي أنا أول ناس اللي تعرفت عليهم في السيميوليشن في 2008 في ألمانيا، فزميل قديم بالسيميوليشن وابن البلد عندكم، وإن شاء الله يعني ما بيقصر معكم، ونحن موجودين كمان بنحب نشوفكم دائما.
دكتور كارلوس، بس سؤال، دكتور سم بروجرام سوفت وير هو من اي شركه او من اي بلد؟ من المانيا، من امريكا؟ بس بدي هاي المعلومه.
هذا ايطالي، شركه اسمها
إيطالي. اوكي تمام.
بيجي معاه ربطه باستا في
شكرا لكم، شكرا جميعا.
يعطيك العافيه. يعطيكم
انا راح
العافيه.
اتواصل معك سيد بلال، شرفنا فيك.
هاي تلفوني صار عندكم على الداشبورد دكتور كارلوس واخي حسام، هاي التليفون عندكم على
ولا
الداش.
يهمك ولا يهمك.
اول
شكرا
عمرك لك ذوق. نهاركم سعيد.
شاكر لكم.
Thank you. If you allow me, I just want to let you know that we will be doing every week. We will be choosing 2 products of our portfolio, and we're gonna have like a demo, online demo, as we did today. So for it's gonna be Monday and Wednesday. So next Wednesday will be our demo on the cath lab simulator. It's also a very interesting product of our portfolio that we as well. And we're going to share as we did this time by email, and it's on our social media as well. If you visit us on social media, please like our pages so you can have our continuous update. Thank you again for attending, and I hope to see you next time.